All right, we want to welcome everyone to our fourth webinar in our series for creating trauma-responsive schools. This webinar is focused on the implementation assessment tool. We want to welcome those of you who were able to join us today in the midst of us all getting used to a new normal as we're all responding to this global pandemic. We know that you may be joining us from someplace that isn't usual. You may be joining us from home, and that's okay. We're all going to try to work through this together. We're just happy you could be here, and as we have done with our other webinars, we are recording this. This is a 90-minute webinar. My name is Kelsey Schmitz. I am the School Mental Health Lead for the Mental Health Technology Transfer Center in the Northwest region, and I work at the SMART Center at the School Mental Health Assessment Research and Training Center. So this is our normal disclaimer that the views and opinions and content expressed in this presentation don't necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. So as I mentioned, we're on our fourth webinar, and you can see if you haven't joined us for previous webinars, we have conducted and recorded 3 other webinars, and those are all located on our website, and you can get to that link by clicking the bottom. We'll be sending out a copy of this PowerPoint as well as posting the presentation and the recording on this page, so all participants will get a copy of the link to the recording and the PowerPoint. So if you're not familiar with the Mental Health Technology Transfer Center, these 10 regional centers were funded in late 2018. In addition to 10 regional centers, we have a National American Indian and Alaska Native MHTTC and a National Hispanic and Latino MHTTC. So no matter where you're joining us from today, you have a regional MHTTC that you can tap into for local resources, but you're also welcome to utilize the resources from other MHTTCs around the nation. So the goals at our Northwest Mental Health Technology Transfer Center for our school mental health supplement are to provide direct training and TA on the implementation of mental health services in schools, to build infrastructure and create learning communities, and support educational leaders to promote mental health for all. This is our key project staff at our center. Myself, Kelsey, and we're joined today by Megan Lucy, our program coordinator, and we also work with our project director, Dr. Eric Bruns. So we welcome you to get in touch with us. These are some links to our website. We have a monthly newsletter that we put out, and then we also have joined the world of social media, so we encourage you to follow us on Twitter and Facebook. As you all know, if you've joined us before, we're required by our funder, SAMHSA, to complete evaluations at our trainings. So at the end of this, we will put a link up that you can follow to take the evaluation. We really appreciate you doing these. We have a whole evaluation team that creates summary reports for our presenters and for our team, and we use this to adjust our trainings to make sure that we're delivering high quality professional development. So again, we really would encourage you to fill these out. We tend to have lower evaluations on our online format, but we just want to encourage you to just take a couple minutes. It would really help us out if you filled out those evaluations. We will finish a few minutes early to give you some time to do that. And last but not least, our amazing colleagues are joining us today from the University of Southern California. We have Vivian Villaverde and Pamela Vona. And at this point, I'm going to hand it over to them. But I want to mention quickly, if you have questions, we would encourage you to use the Q&A feature that you should see on your screen. We'll do our best to sort of answer those live as they come in. If there's a natural pause for the presenters, I'll break in and ask those questions. If we don't get your questions answered, Vivian and Pamela have been really gracious to follow up on any questions that may take just a little more time or may need some additional resources to be shared. So at this point, I will turn it over to Pamela and Vivian. Thank you. Welcome.
Thank you. Thank you. Well, good morning or good afternoon, everyone. We're so glad that you could be here with us today, given all of the things that are going on and our attention on keeping ourselves and our loved ones safe and healthy. But we are excited to share this information with you, and in particular, this tool that we've developed. But just a quick bit of background. My name is Pamela Vona, and I am currently with the Treatment and Services Adaptation Center for Resiliency, Hope, and Wellness in Schools. And we are also a federally funded center through SAMHSA. And our center is really a virtual center. And we're comprised of 3 academic institutions, as you see here: USC, the School of Social Work, the RAND Corporation, and UCLA. And really, to give you a little bit of background about the center has been around for about 20 years. And originally, when the center started its work, it was really focused on developing what are now some of the most commonly used mental health interventions for trauma to be delivered in the school setting. You may have heard of some of these interventions like the CBITS intervention or bounce back, or even the SET intervention. And what we've learned is that those interventions absolutely are effective at ameliorating signs and symptoms of trauma. But what we've also learned is that those kinds of interventions are most optimal and most easy and most best sustained when they're implemented in a school setting that is fully trauma-informed itself. And so what we have focused on over about the last 4 to 5 years is how do we make trauma-informed work system-wide in a school and not just interventions to be delivered. And so that's what this tool, the TRS-IA, the Trauma-Responsive School Implementation Assessment Tool, was designed to do. And that's what we'll be walking you through today.
And so my name is Vivian Villaverde, and I am a clinical associate professor here at the USC Suzanne DeVore Peck School of Social Work, and I'm also a member of the team for the Treatment Services and Adaptation Center. And as a professional, I'm a trained school social worker, and so my previous life was always been with school districts. I've been trained to provide services to schools and support child welfare and probation kids as well. So that was my prior training. So I've been working with collaboratives as well as different school districts to do some work. So what is a trauma-responsive school system? So if we're looking, we want to make sure that we're unpacking that black box in terms of what does it entail to become a trauma-responsive school system? What kind of principles are we going to use? Are we doing something new, or how are we potentially aligning it and integrating it with all the things that we're already doing as a school system, particularly the RTI, the PBIS, and the MTSS? And so that's one of the things that we want to tackle today, to see how we could potentially align and integrate and not create something new again and tax the system. So before we get into that, before we get into the assessment tool, we wanted to kind of do a little bit of a review. This was something that we discussed when we talked about trauma-informed MTSS last webinar series. And so we wanted to review the guiding principles for trauma-informed care or a trauma-informed system. So based on SAMHSA, again, we're trying to make sure that we're aligned with the federal government's language, because one, we want to make sure that we have access to the same and we're competitive to the same resources, and also looking at how do we align the language of the school and the language of the federal government in terms of the Department of Justice and SAMHSA as well. So according to SAMHSA's documents or website, there are 6 guiding principles to what a trauma-informed care system is. So one of the things to consider is that, are we looking at safety when we're looking at our systems? So trust and transparency, peer support, collaboration and mutuality, empowerment, voice and choice. And lastly, are we engaging in cultural humility? So we're going to look at this individually. When it comes to the principles of trauma-responsive systems, we're looking at, are we looking through a lens of safety? Now, we're not just talking about physical safety, we're also talking about psychological safety, access to the supports, and modeling of calm behavior. So as you're looking at the entire school environment, whether it's the classroom, the cafeteria, or the grounds, are these some of the things that we're considering as we're developing maybe protocols and as well as designing those spaces? Peer support, positive interactions between students are encouraged and acknowledged by the staff members. And we're also looking at, are we giving them appropriate opportunities and to practice interactions, positive interactions, not only amongst the student peers, but in the staff peers as well. Staff members are recognized as one another's strengths, and how much are we fostering that collaboration, which in itself is a principle. Trust and transparency, are the expectation clear no matter what part of the system, the educational system we're navigating? Is there clear expectations? Is it predictable? Is it consistent? Okay. And then looking at collaboration and neutrality, are we fostering or are we supporting partnering? Again, we talked about that earlier in terms of the peer collaborate or the peers earlier, that one of the principles. Are we really, one, are we fostering that collaborative spirit of working together and being in the same page and sharing the same goals? Are we also making efforts to level the power? Does everyone have a voice in whatever decision making, as well as program development? If you're looking at MTSS and PBIS, we know that it relies heavily on those teams. And so this is a space where we could really check if we are fostering a collaborative and mutual partnership. And then, as I mentioned earlier, that meaningful shared decision making, are we tapping into all the stakeholders so that we are definitely getting their input? And not only that, we're also investing in ownership from everybody and all stakeholders in whatever it is that we're trying to do. Okay. And then empowerment and voice and choice. Are we providing opportunities for success? Not just for a few, but for everyone who's a part of the partnerships, the collaborations, and the system as well. Are we engaging them? Do they really have a voice? Are they just at the table, but really does not have a voice? And then is it also possible that when it comes to the decision-making power, decisions are made after the fact that, all the contributions might have been shared, but still there's a power and authority that overrides whatever it is that's being said on that table. So are we encouraging students to identify? So on the student side, are we encouraging them to take part? Are we really listening to their voices? Are they really? Are we really giving them some control over some aspects that they could potentially have control over? Are they being engaged in some of those processes and protocols? I think the higher the grade, I think there's potential for more participation from our students and empowering them to make sure that they're part of that decision-making power. And then lastly, are we capturing all the successes? I think part of a change process and system is that we are acknowledging those tiny successes until we've created an entire culture shift. And I think for those of you who are doing PBIS, this is something that is very, very familiar, because I think the ultimate goal is that culture shift, but we need to make sure that everybody's experiencing some successes, that they would continue to join the journey and be involved and get their buy-in completely. Okay. And then looking at the last principle, the guiding principle that we could use as we become a trauma responsive system is that cultural humility. We need to make sure that we are focusing and learning about the cultures, the students, the families, even those subcultures in terms of the community that you belong in. You might be one full school district, but are we taking into account that each of the school might be in a sub-community where there's a particular distinct culture as well, and knowing who those key stakeholders are, that could help us understand the community, but also help us get the buy-in of all the stakeholders by partnering with them. Identifying the strengths and assets of each culture. Again, fully understanding the families and where they come from and the experiences that they might bring with them, as well as that local community where our schools are a part of. And then understanding protective factors and coping mechanisms. And so when it comes to understanding the culture, acknowledging everybody's culture, are we also tapping into the strength of those particular cultures, and how are we incorporating that in some of the developments that we're doing? Okay, and then the last one, in terms of cultural humility, are we aware of our own biases? And again, this is something that we might be unconscious of, and we're bringing it to the work that we're doing, and it's manifesting. So understanding what those potential biases are, and not only coming from each and every one of us, but looking at the system itself. Is it predisposed, or is it bringing in built-in biases that might be countering or becoming a barrier to whatever it is that we're doing when we're trying to become trauma-informed? So, looking at that, you can see that those 6 principles are really going to be very, very important as we move on to the work that we're going to do. And I'm going to hand it over to Pamela so that she can take us to the next section.
Sure. So as schools are being called to become trauma-informed systems of care, for a long time, those guiding principles were really all schools had available to help them determine how do we transform our system into one that is trauma-informed or trauma-responsive. And of course, those principles are aspirational, and those are the benchmarks that we want to meet. But what's true is that those principles were really laid out for all kinds of systems. Child welfare systems, juvenile justice systems. And what we know is that schools are a very unique system in and of itself. And so what there isn't out there is a lot of guidance, helping schools identify, well, how do we operationalize these principles into our everyday practices and policies? There was simply a gap in guidance for administrators. And so really the impetus for our center was to fill that gap. And we wanted to design what could be a user-friendly online instrument to help schools evaluate what they're currently doing right now in the way of things that are trauma responsive, and also help them enhance their trauma programming and policies moving forward. And so our center really went through a very thorough development process. And before we could develop the tool itself, we had to develop a framework for a trauma responsive school. We just had to, because there weren't very many out there. And so we did what's called the RAND UCLA appropriateness methodology. And that's a way of synthesizing expert literature and expert opinion around a topic. So we convened a panel of 10 national experts to help us identify what do we think the primary domains of a trauma-responsive school are, and what are the specific indicators within each of those domains. And so I'm obviously not going to take you through the details of the timeline itself, but as you can see, it was about a year-long process where we engage national experts to develop this trauma-responsive school framework. And so, in a way, this is what we originally developed. As you can see, we are using SAMHSA's guiding principles and trying to infuse them into practices, but we also were thinking about how we organize and frame the practices. And at first we thought about, all right, well, we know we need to have those targeted trauma responsive practices for kids who are definitely showing symptoms of trauma and need additional supports. And then we moved through the school system all the way out at that outermost circle for community and family support. And what could we be doing for them? So we really thought about these spheres of trauma responsive support wrapping around our students. But then as we thought about it more, we realized that our schools already have a number of frameworks in place. And in many ways, the work of becoming trauma responsive very much aligns with a multi-tiered approach. And so instead, if we were just to flip those concentric circles on its side, it starts to look like something we're all a lot more familiar with. Whether you're doing PBIS or RTI, this tiered support approach really lends itself to trauma-informed practices as well. And so after we came up with that overall framework and the structure, we were able to develop what is the trauma-responsive school implementation assessment. And we'll take you through all of the details of this today, but just to show you, the trauma-responsive school implementation assessment is housed here on the SHAPE platform, the School Health Assessment and Performance Evaluation System. This was developed by our partners at the University of Maryland through the National Center for School Mental Health. So it's very possible that many of you already have an account on this system. If you don't, we encourage you to set up an account. It's quite user-friendly, but we're always available to help you should you have any trouble creating your account. And then what happens is once you're in, you'll, if you're scrolling across the top there in that blue bar, you'll see what's highlighted on trauma responsiveness. If you're interested in looking at just this assessment, you'll click on that button there, and the full TRS will become available to you. And so as you can see, there's 8 different mini domains that you can answer questions to. And I'll walk you through what each of those domains are and how they align with the framework we developed. If we're just quickly looking back at this slide, you see how we have all of these domains. Each tier represents a specific domain. So the first domain are our community and family support. Our expert panel felt that this was critical to being a truly trauma responsive system. So in this domain, things that get assessed are, does the school routinely engage families and communities? And are they engaging family and communities specifically about trauma and trying to educate about the impact of trauma? Are there ongoing partnerships with trusted community organizations? And how do we formalize those partnerships and bring individuals from those organizations onto the school campus so there's that connectedness between the school and the community? And so what would happen if you wanted to get a sense of how your school or district is doing, you saw where those 8 boxes were, you would click on Take Survey for the Family and Community Engagement domain. And after you answer about 4 to 5 questions, each domain has about 4 to 5 questions, you will get what you see on the left-hand side is a feedback report. And it's going to tell you how you're doing in each of those domains. What is your level of community partnership, your family outreach, and what sort of racial and ethnic sensitivity training and resources do you have available? Then You also have access to a strategic planning guide that comes along with this feedback report. And you can begin thinking as a team, well, based on these scores, what do we want to prioritize? What are we doing really well? And where do we need some quick support? And where are the resources to be able to do that? And that's what this strategic planning guide allows you to do. But you're not just going to be left alone with these two documents, a feedback report and a strategic planning guide. What you also have is a full resource library. So again, if you're scrolling on the top and you click on resource library, and then if you click on the trauma responsiveness tab, then on the left-hand side, you see all of those domains. And on this slide, we've clicked on engagement, which stands for community and family engagement. And you'll see that it shows of the 110 resources that are in the trauma responsive library, 10 of them give you information about enhancing family and community engagement. And at the top of each when you click on a domain, you get a full guide. And this is the Family and Community Engagement Implementation Guide. And so not only did we create the assessments with our experts, we actually created all of these implementation guides with our experts. And so what you'll see is that we have identified best practices that relate to family and community engagement, and we've also identified a way of implementing them based on the experiences of the experts that we utilized during the process. Of course, you don't have to follow these exact guidelines, but they're there as a helpful guidepost to you.
Pamela,
So
we've had a few questions come in. Can I break in just for a minute?
Absolutely.
One I thought everyone would like to hear the answer to is they may have missed this, but are all of these assessments free?
Yes, absolutely free.
Another question: in rural Nevada, significant dismissal or denial of toxic stress and trauma. I had rough childhood and came out okay. Kids are resilient. They'll get over it. I got over it. They'll get over it. How to get buy-in and willingness when you have this kind of a culture?
Yeah. So we'll talk about that a little bit when we get to one of the next tiers about trauma programming. And we'll also get into it when we talk about staff support. So I'm going to keep that question in mind as I move forward. Mm-hmm. And
Sounds
if it
great.
doesn't get answered when I get through those couple of slides, I'm happy to circle back to it. But that's a very important question.
And Kelsey would probably keep us, on our toes and remind us at the end.
Yeah. Now, was that it for now, or are there others?
Yeah, there's one I'm going to ask for a little bit more clarification on, so you guys can proceed.
Okay. All right, we'll move along. All right. So then, after we're thinking about that community and family level, then we're moving up and we're thinking about, okay, on campus, first and foremost, we need to make sure that there is physical and psychological safety and that we are preventing any sort of traumatic experience from occurring on campus. And the practices that align with this tier of support include a routine school climate assessment. When we have emergency drills, are we doing them in a way that are trauma informed so as not to revivify traumatic experiences for some students? Many schools are utilizing school-wide behavioral expectations, and that certainly enhances a sense of safety on campus and predictability. Have we assessed our adequate supervision? What does our threat assessment strategy look like? And do we have bullying prevention strategies on campus? So those are the types of what we call indicators that go into the safety and prevention planning domain. So again, if this tier of support is of interest to you or something that you want to focus on, then you would go and you would click on Take Surveying for the whole school prevention planning domain. And again, after you answer the various questions, you'll see here that you will get a numerical value score for each of the domains, such as record sharing, trauma-responsive emergency drills, all of the questions that are part of that domain. And then similarly, you have your strategic planning guide. But again, that's not, we want to make sure you have more to be able to complete that strategic planning guide in a way where we're using expert feedback. So again, you'll go to that resource library, you would toggle on to prevention planning. There are 26 resources in the resource library focused on whole school prevention planning. They will be, you can scroll down to find them all. The top one is always that implementation planning guide that looks like this. And again, this is a summary of all of the best practices that we found with our national team of experts that we vetted, and again, that we've done our best to create an implementation approach for each of these best practices. So you can find that information there, and then of course use all of those other resources in the library as supplemental material to move these things forward. At this same tier, we also want to be thinking about school staff support. When we were doing our RAND UCLA appropriateness method, the experts were very clear that this was an essential domain of a trauma-responsive school. So some of the indicators to show that you are working on this and building capacity for this on your campus are you doing things to build awareness about compassion fatigue? And STS here stands for secondary traumatic stress in teachers. Are there options for peer support amongst staff when we're constantly working with kids who are trauma exposed? And are there specific on-campus resources? And so this a little bit gets back to that question. What we found is that a lot of people, we can ease our way into the discussion of student stress and student trauma when we talk about it amongst ourselves first. And that doesn't necessarily mean getting into the personal issues of our trauma, but being aware of how it might be manifesting for us and how we can support one another. And I know that oftentimes when we're first working with a school district, when we do the secondary traumatic stress in service first to support teachers, there's often a lot more buy-in than to do, say, a trauma 101 that then piggybacks on that information and allows them to understand what's happening with the students. So that's one strategy that we found useful, but there's other things you can do as well. So again, not to be overly redundant, but if you're interested in how you're doing for staff self-care, you would take that survey, you'll get your report along with that strategic planning guide. You would go to the resource library and then click on the guide. And again, here's what we could find in terms of best practices for secondary traumatic stress, compassion fatigue for our teachers, and how we can roll out some of these practices in school. All right, and then we have whole school trauma programming, right? This is really all of those tier 1 interventions that can be utilized on campus. So first, do we have staff trained to be able to provide emotional support to students following a traumatic event that occurs on or near campus? Are we thinking about discipline policies that take trauma into account? Are our school security and police trained to respond using tactics that de-escalate situations, or are you using restorative practices? But, and again, I also want to keep that question in mind because it's such an important one. this first bullet about having staff trained to provide emotional support, well, that can only be done if there's buy-in, right? So I really think we've had some luck with some of the kinds of Trauma 101 trainings that we do that really emphasize the reality of how trauma is impacting student learning, and then what is that impact on the success of the school. And when we tie all of those things together, it really depends on who you're trying to get buy-in from. If it's from an administrator, then often those school level benchmarks are important to them. Whereas if we're trying to get buy-in from a teacher and we're really showing the brain science and we're saying this is how we can unlock the child's brain to learn, and in some ways how trauma is inhibiting their brain from learning. And I know that we've had a lot of success when we show those brain scans and we show the different regions of the brain, that people tend to take it a little bit more seriously.
Yeah. And I have a couple of sort of suggestions in looking at what do you have now. I think a good starting point is understanding what are your schools doing right now. Do you have a collaborative team? Do you have like a PBIS team? So are they your first sell? Does that make sense? And I think like bringing in and approaching and then potentially talking to them about utilizing this tool as a jumping board for whatever it is that they want to advocate for. Because one, you'll know the areas where you might need some more work, and you can also identify some of those low-hanging fruit. In terms of what is something where you could, which one do you want to approach first, which one you want to focus on first, so that you can experience those small successes where you can show and really track some movement. So maybe that is the strategic way to do it, so that you can continue to show some sort of, evidence that moving incrementally would be really helpful. And that's where you can utilize some of the actual work that you're doing to get more buy-in from the bigger stakeholder. So those are the kinds of things that you could consider. And usually whole school programming is where everybody is looking. Some of the low-hanging fruits might be on this one, or it could be in the staff support, like what we've said earlier.
So that's a really good point, because I think some of the reluctance is, oh, okay, we have to bring a whole new set of things onto campus. And that's overwhelming. That's going to be disruptive. And what we want, when you get those feedback reports after you complete the questions in a particular domain, we hope that you see that you may be doing a number of these things already, and that you maybe didn't realize they were practices that align with trauma principles. But now you're able to see that and do that with more intention and with some confidence that, yes, we do have some trauma-informed practices on our campus already. Do we want to bring on more? And are we able to see areas for improvement? Absolutely. But really, those feedback reports, we hope, are designed to show you that absolutely you're on your way in some areas, and then there are opportunities for growth in other areas. Mm-hmm. Okay, and similar.
So we do have another question
sure.
that came in. I think I may have somewhat of an answer as well. So let me see what you all think first. Do you have suggestions for the timeline and alignment of how trauma-informed tools can be used with other MTSS implementation tools? I think there's a lot of tools out there, and I think trying to determine, what you're going to give schools the information they need for action planning without duplicating or overburdening the amount of assessments they're taking is really kind of at the base of this question.
It's a good question. And again, it really does vary from district to district. I mean, based on what the MTSS, for example, mandates are within a particular state. I'll let Vivian start, and I have some ideas.
Yeah, and I really want to hear what you have to say too, Kelsey. I think this particular tool is a little bit different, because it's not just a data tracking tool. What is the important part of this is I think this particular tool goes hand in hand with any other tool that you have. Because if you notice, it is more in terms of, it does survey the status or where you're at currently. But the most important part of this tool, which I think, that was not the original intention, but that's where it actually developed and where it gathered its strength, is that it provides sort of a strategic planning guide. It serves as a strategic planning guide in understanding where are the gaps, how can we address the gaps, and then what are the resources that are available to address those gaps. And even the resources that it provides, it gives you additional assessment tools, an actual assessment tool to track whether and we'll get into it later, I'll show it later, whether the students are really achieving those improvements that they might want to. So there's a versatility to this that I think that is helpful, because more than just an assessment tool, it is a strategic planning guide. And I think that's why I think it's easy to find connection and alignment and other implementation and data gathering tools that you have. Just looking at Swift, the Swift paired with this, like you kind of can see where your scores are high on the Swift, like if it's, the safety or whatever it is that you're looking, the referral, then this particular assessment tool could be paired with it so that you can develop a strategic plan on which one or which area you want to address and which area you want to increase sort of training and resources on. I don't know if that's making sense, but that's where I find this more versatile and can be paired with other existing implementation tools that you're using.
Yeah, what I can share sort of at a national level is there's a group that's sort of forming to start having these conversations about a potential crosswalk of all of these tools. So the SHAPE tools, the PBIS evaluation tools, the new RISE tool through Kaiser Permanente, and some of those other tools. And in Washington, it seems like we have are kind of at the forefront of all of these great resources. And so we're taking that opportunity to pull some folks together at the national level to work on some common messaging and just some technical assistance when it comes to, here's the tool, what's the purpose, how can it be used with other things. We're kind of in the early stages of that, but I just wanted to point that out, that's a common question that we get. And for those of us who are doing training and technical assistance, we want to be able to offer some support for how to use the tools that you need without overburdening your system or feeling like, well, this tool tells us something similar that another one did. So I can tell you that hopefully some of that guidance is coming.
Yeah, and in reality, a lot of times it's hard to do this kind of work in this large, virtual sort of setting. I know, and Vivian will be talking about it later, how we've worked with a school district here in Southern California where we did just that, and we've crosswalked the domains of the TRS with their PBIS tiers. And so when we have the opportunity to have a little bit more one-on-one time, then we've been able to kind of tailor those conversations to a district. But certainly some national guidance on that will be helpful too. But at the same time, I really think some of that tailored crosswalking is what's most helpful. All right, so just back to the tool again. You take your survey, you get your feedback report, you have your strategic planning guide, you go to the resource library and you get all your recommended best practices for that domain and strategies for implementing them. Then we move up to classroom-based strategies, which was another key component that our expert panel decided needed to be part of a trauma-responsive framework. So is there routine use of social emotional learning programs across classrooms? Have our teachers been trained to create safe and calm classroom settings? And to what degree are we integrating trauma history into the IEP process? Again, those are some of the questions you would be asked when you take the survey. You get your feedback report. Look, they're doing really great in one area, not so hot in another. That would help inform what you want to work on. Then you go to the resource library, pull up this implementation guide, and identify what it is that you want to work on first, and use the recommendations to help you move that forward.
Mm-hmm. So moving on to, if you notice, in terms of the top two concentric circles, that is basically your RTI. So this third one Pamela just talked about is your tier 1, and now we're moving into that a little bit more focused services, early interventions for our trauma students. And so part of that would be inclusion of trauma items in mental health assessment, depending on your district, depending on where administration as well as the district policies are. Are you doing a school-wide assessment, capturing who needs what types of services, and identifying that early on? And I know that there are a lot of concerns. I wouldn't go in that direction if you don't have all the services in place and the safety net in place, because again, identifying those students might not be beneficial, because then there's nowhere to send them to for those additional services. So understanding that's going to be part of that assessment and strategic planning that you're going to do. And then also looking at consistent implementation of trauma-informed services and evidence-based practices. Do you have the infrastructure of supports that would help you deliver those types of support services to your students, especially the early intervention ones where you're trying to capture those who are starting to show symptoms, but not in an elevated way, so that you want to mitigate more serious impacts on learning as well as on their social emotional well-being. So some examples of those evidence-based practices that you can start integrating in your schools are CBITS, cognitive behavioral intervention, trauma for schools as well. Those, again, are still a little bit more targeted because, one, they have to be delivered by mental health practitioners, but then you can also start including other services like it may be skill streaming or support for students exposed to trauma. This one is developed to be delivered by non-mental health practitioners, including teachers and case managers and counselors that are at the school, or behavior specialists. So it depends on how you define those particular roles within your school. Bounce back is another one. So just to kind of demonstrate a little bit, and I'll talk about this later in the slides, ABC Unified School District, for example, what they've done is they decided to look at developing the actual infrastructure on how they're going to identify students and triage. So before they can go into any of those things, their low-hanging fruit is, do we have that triage system? So then they decided to partner, and I'll elaborate more later. They decided to build an MSW, a counseling, an MFT internship program, and partner with local universities so that they would build that first line of defense and provide services to their tier 2 students. And understand their needs as well, and also build a relationship with the community so that they can refer them back and forth. As the intensity of the needs increase, they need to reach out to their community partners. So that infrastructure was very important in getting this needs met. So that's where they went first. So if you want to go and look at yours and where you're at, you can again take the survey, view the report, and then you will see here in terms of the scores, and then again, the strategic planning guide. And we're skipping the resources slide because by now you're kind of familiar on how to get there and choose the section. And here you have the different resources and suggestions. And I've said earlier that even the strategic planning guide or this assessment tool provides further or additional resources in terms of data collection and assessment tools to track on a more intensive way some of the movements and improvements that your students might be engaging in as you provide those additional resources. Here you can see some PTSD symptom scales. You can also see the trauma events or inventory scale for children. So if you're looking for those additional targeted type of data collection, that is something that this particular resource guide is also going to be able to provide in combination. Okay, and then looking at the highest needs that the group of students that with the highest needs would be our targeted interventions for trauma. And this is again looking at multidisciplinary team meeting, include trauma exposure conversations. And I think this might be you could also categorize the kids who might be at the highest needs or going to the very last or the very top level of starving, and also some of your child welfare students, your foster care students, when DCFS is involved and they're coming into your campus and meeting because their kids are moving so much in your system. So these are the types of kids that we want to target and make sure that you have the services. And so in this particular one, the partnerships with the community is very, very important. How well have you mapped who your mental health partners are? And are there established MOUs as well, so that the kids you are referring to that highest level of care are not being waitlisted and are not waiting for 2-3 months or sometimes even up to 6 months. So is there a clear MOU and understanding in terms of how are those students going to be ushered from your system to their system, and what is the reporting back as well? Is there streamlining in the communication so that if there's any supports that could be developed in the school to complement that and vice versa, there's real collaboration and partnership in that. So in terms of this particular tier, ABC Unified School District, who we work with, they actually developed a CRT team, which is a community resource team. And they reached out and they mapped every single community agency that comes on their campus, and they streamlined it and centralized it so that they report to one unit and they're able to keep track of them. They also developed a report, an MOU that's very, very specific, that includes what is the referral process and what is the response when those referrals are activated to their partners. And so they also meet once a month. So then part of it too is that the agencies reporting to them how many students are referred, how long it takes the referral to be seen, and what are those, who are the contact people for those, so that those who are in the particular schools can then create a more collaborative approach so that there's continuity of care from the school to the community resources and back to the school again. And so that's what they're trying to foster. It's not going to be easy, and it's not going to, but it developed over time. It's not something that happened overnight, but the system and accountability was developed over time, and they became, there's a lot more collaboration, and they have mutual goals for the students. So looking at the more targeted, you can take the survey again, and again, view the report, and looking at community mental health partnerships and being able to identify those, having multiple ones, because again, you might have a more focused need and you might have a more generic need. So understanding what are those other availabilities, and potentially that could include family referrals for the entire family. So looking at multidisciplinary team as well in terms of who comes in and what the kinds of meetings are being held on behalf of the students that you have. And then here you have the strategic planning guide as well. And then next, depending on the scores, and if this is something that you want to focus on, decided by your own team, looking at the different resources and suggestions and active steps that you can take as you move into enhancing this particular domain as decided by your team. Okay?
All right. So I'm going to take you through a quick demo of the site. But before I do that, I just want to say a couple of things. First and foremost, we feel like the TRS-IA is best utilized when it's completed by a team. a team of very varied stakeholders who are able to give their perspectives. And this can include parents' perspective, community agency perspective, and even student perspective. So we really want you to think about who would be, if you have a natural, already a school-based team, if you can leverage that, or if you need to develop a team, we really want it to have that multi-stakeholder aspect to it.
Mm-hmm. And just like what we have said and mentioned in the last webinar in terms of your trauma-informed MTSS, and just like what Pamela said in terms of leveraging pre-existing team, I think that is something that is worth investing in terms of that conversation and decision, whether you're going to use a pre-existing team or not. I think really looking at that team and are your paraprofessionals represented? Are your security officers represented? Behavior specialists, and I know almost all the schools have strong and active PTAs. Are they represented in that as well? So those are the kinds of things that should be considered because, again, they are traversing and they are experiencing your campuses as well in your processes.
And then we also get questions about who can see the data. So one thing that I want to say first and foremost, the only people who have access to the data are us as the developers. Of course, you can pull up your scores, but in terms of there being any other institutions that we share this information with, we absolutely do not. And the TRS can be taken at the district level or at the school level, or both. Within a district, you might have the district complete the TRS-IA, and then each individual school also complete it on behalf of their school. There is also a way, if a school chooses not to share that information with the district, you can elect to either share your school level data with the district, or you can choose not to share. So there is that option as well. So now we'll just quickly launch on, and I just need to quickly get on the web. All right. So then I can just go ahead and,
so it's BigShapeSystem.com.
That's the website. And then if you haven't done so, you would sign up here, and it's relatively straightforward. But again, if you have questions, let us know. And then when you have your account, you just go ahead and log in, and I will do so. That's me, and I should be logging me in. There we go. All right. So this is what it looks like when you log in. And as you saw, there's this blue bar across the top. And depending upon why you're coming to the SHAPE platform, there's all of these other assessments. But if you're coming for the TRS, you could go ahead and click here. And that's where you will have access to the trauma-responsive school implementation assessment. And so this should look a little bit familiar now, where you have the 8 domains that we just walked through. You can choose to take all of these domains at one time, or you can choose, if there's already a particular domain that you know you want to focus on. I'm hearing from a lot of schools that this is the one that's in the next school year they want to focus on. They jumped right into that. But you may want to go through all of them and let the results dictate where you want to go next. But the idea is, as we showed, you take the survey, and I'll just quickly show you what this looks like. All right, this tells you a little bit about what this domain means, but we've already talked about that. And then you'll be asked a question, and you rate on a scale from 1 to 4. So we'll just say we don't have that, and we're not doing so hot on this. Similarly, on the climate assessment, we're never doing that assessment. To what extent are your emergency drills? Somewhat. School-wide behavioral expectations. So we got through all of our questions, and now we go to submit. All right. So as you can see, we just updated it right now, and then I'll view this report. And you can see that you get the whole report, as I said, which can be downloaded. It's followed by that strategic planning guide, which goes on for several pages. Let me close out of this. So after you step through that guide, like we said, what you can do is then go up to this, sorry about that, the different mouse. You'll want to go to this resource center here. Click on trauma responsiveness, so you're only working with those. And if you wanted to focus on prevention planning, like we said, you click here, and there's 26 resources. I'll scroll down, and you can see all the different kinds of resources we have for this level. And as we said, at the top, you'll always have that comprehensive guide that tells you about all of the best practices, and it's describing many of the resources that are included in that library. So I'm wondering, are there any questions about functionality before we transition back to the slide deck?
I don't see any questions at this point, but I'd be happy to pause. Oh, one just popped in. I thought maybe that might happen. No, you're just getting reinforcement. Great work. Thank you.
Okay, great. So now we'll toggle back to, is this where we were? I'll let Vivian do it. Okay, so just to give you a little bit of data on how people are experiencing the tool, we're finally starting to get a sense of whether it's effective. And so we did a survey, as you can see. Now this survey was about a year ago, and so at that time we had at most 365 schools had completed the domain to date, and then a certain subset of those schools elected to be a part of the survey. And what we asked on a scale from 1 to 5, 1 being strongly disagree and 5 being strongly agree, was, are the domains relevant to being a trauma responsive school? Do you agree that the kinds of things we included in this assessment are helpful towards you becoming a trauma responsive school? And overall, you can see that most people found them to be in line with what they consider trauma responsive practices. Additionally, we asked, how helpful was the platform? Or do you think this platform is helpful in helping you plan and integrate trauma responsive practices onto your campus? And again, we got some decently high scores, so we feel like we're moving ahead with something that is acceptable and useful to our users. And so far we know that that's going relatively well. And then we've engaged in some other projects to see how the TRS is being used to move programming forward. And I'll let Vivian start by talking a little bit about that.
And so looking at the different domains that we looked at the different domains that we focused on the TRS-IA, you can see how the principles, the guiding principles from SAMHSA, how that's really built into it and how it aligns as well with the MTSS, looking at safety, trust, transparency, peer support, collaboration and mutuality, empowering voice and choice, and cultural humility. So what I'm showing you on the right, what we're showing you on the right is the California MTSS model, where, as you can see here, MTS is that umbrella that houses everything. And then you have your academic, your behavioral, and your social emotional, and the whole school itself. So the way they envision it, and also the way we're sort of looking at aligning it, is if everything that you're going to be doing here is going to go through this lens, then you're creating a trauma-informed or trauma-responsive MTSS and school system. if this is going to be your guiding principle and looking how it's built into the TRS-IA, it's a transformation that makes a lot of sense, and that's pretty natural. And so the breakdown of this in terms of the MTSS, whether you're only doing RTI or you're doing a combination of RTI and PBIS, that is what's within your framework. That's what, it brings together all the different programming that you're doing, and that aligns them to support the whole child and the entire system, if you look at it. So that's the goal of MTSS. So just to kind of give you an example, so in Southern California, because we're a school of social work, we tend to partner with a lot of different organizations and agencies to host our interns. And so with that, they are able to access the resources that we have as a university as well. And so one of the things that we have been able to do really well is partner with our local school district. And when we started partnering with them, maybe like 5 years ago, the great thing that happened is that most of them are starting to build their own infrastructure for support services for their schools. And so when somebody asked about that buy-in and who's at the table, one of the things that we sat down with, or some of the things that, you might not start with this assessment tool, or you might. Some of the partners that we have, especially ABC Unified, in hindsight, they wish they had this tool when we were doing it, because then they would have been more strategic in what they're doing. And so, like what I've shared before, ABC Unified School District really started from a physical infrastructure where they can really triage kids and be seen. And then based off of that, and the teachers, the principals, they saw the impact of having that ready support at multi-levels. Then they started opening it up to more and more movement. And I'll talk more about ABC in the next slide. Pasadena Unified School District, what they've decided to do was actually start with a district-wide policy, a freestanding mental health policy for their district. And so what they did, because it was great timing, the TRS-IA was actually available and it was launched the same year that they were tackling this. They actually took the TRS-IA and looked at the different domains and actually pull some words and pull some of the focus of those domains into their actual policy. So why they decided to go for the policy first is that because everything that they're going to do next, all the implementation and program development, they wanted it to be backed up by a policy, so that then there will be some sort of supported movement from the rest of the stakeholders that this is something that's an imperative and that we have to do it. So that's the route that they decided to do. As you can see, there is no one approach on where to get that buy-in and where to start with it.
And in that case, it was approved by the school board.
Yes, and so I think they're one of the few districts in California that actually has a freestanding mental health policy that covers all of the mandates of the state in terms of suicide prevention and mental health and other services as well. So Torrance Unified School District, just quickly, this is a new partnership that we have. No, we've been partnered with Torrance Unified School District, but Sherry Alternative High School, they have been overwhelmed with the different issues and problems that teachers are encountering and students are encountering, and the system is just being overwhelmed with all the trauma exposure and the things that are happening at their school. So the principal approached us and we started talking to them. We do have the internship program, but this is a particular project with this small school because it's an alternative school within that district that we are looking at starting from the ground up and really looking at using the TRS-IA as our foundation in our strategic planning. And so we're going to start that work next year. But in the meantime, where we wanted to get the buy-in and focus is we're going to focus on supports for teachers this particular semester, and then work our way to doing the full TRS-IA, because I think their teaching staff and their support staff, they're just so overwhelmed that we want to invest in them so that we can move forward with the rest of the work. Okay. So ABC Unified School District, as we've mentioned, they wanted to start with something that they could that's something that's visible, tangible, and that can be immediately seen as as supports for the teachers and for the entire school. So that infrastructure where we decided creating that internship partnership with the university and placing interns at their schools, that would be their first line of support. So kids who are having problems in the classroom, they can see the interns first and get that immediate support. And interns also develop groups, second step groups, skill streaming groups that can be delivered in the higher needs classroom so that teachers can visibly see. So once they've done that, they've also established a connection between that first line of support and their community partners so that there's movement from tier 1, tier 2, tier 3 in terms of social emotional intensity of the supports that they need. And so then students have teachers and principals have alternatives in terms of where they can send them. Once they were able to do that, then they started doing the strategic planning and they're doing their TRS-IA, and they moved on to other implementation. And they've been able to step up and in terms of intensifying the training of their interns, intensifying the partnerships that they have with mental health community agencies. And really now they've brought in Kaiser as well, so that they are getting all the training and the padding and all the different programming that they can implement. And then this year, they decided to focus on the staff supports, which is then looking at self-care. So they did the TRS-IA in that area. And this semester in particular, they look at the resources and the strategic planning guide, and they created a plan that they want to implement for the fall semester. So this year, they're going to focus on their teachers and how to enhance supports for them and understanding as well of some of the things that they're being triggered with and how they can make sure that they're taking care of themselves so that they're constantly building capacity. So that's basically what they're doing. And so it's a constantly moving and changing thing. And the TRS-IA is helping them guide that. But everything that they're doing, I just want to reiterate, is aligned and they fold it into their PBIS plans. And so they're not doing something different, but whatever it is that they're doing, they're just putting it and plugging it into their PBIS plans and strategic goals.
Okay, and then just one last group to talk about. We have wonderful partners in Chicago at Lurie Children's Hospital, and they wanted to take the TRS and see how they could use it with schools and districts who had a ton of need in Chicago. And so originally they did a small pilot with about 3 to 4 different districts, and we're able to just get some high likability. You can hear some feedback, see some feedback here of users felt that the tools helped guide their process. They found the feedback and the recommendations helpful. Now, in the next school year, what they're doing is scaling that up for a statewide initiative. And what's exciting about what they've done is that the state is actually, they're very fortunate, pitching in dollars. And so what they're calling it is a demonstration project, or really the better word is a designation project. So we're not fully certifying people as being certifying schools as being trauma responsive, but we're designating them as emerging, proficient. And what happens is when these school districts go in and take the TRS-IA and identify particular areas that they want to improve upon, the state is granting the district, a small but helpful grant to be able to access those funds, to access resources, to be able to move specific programs forward. And then by the end of the year, determine what their designation might be as a trauma-informed school, again, whether it's progressing, emerging, proficient. So that's a really unique project that's getting underway in the fall, and we'll be really excited to see how it moves and really moves the field forward for the state of Illinois. So really, this is an image that comes from MTSS work, which is really, you're framing the policies and practices. that you want to implement. Then you implement them using implementation science, and then you evaluate the success of those. And really, we believe that the TRS-IA can guide you in all three of those processes, helping to frame things, identifying programs and policies. Then we've given you some guidance on how to implement these things. And then finally, within the resource library, there are metrics to help you evaluate the success of your strategy. So that is the end of our presentation. We've left a few minutes for questions, and then of course for the evaluation.
Great. So I do have some questions here. What about the timing of using this assessment in schools and districts that do not have PBIS Tier 1 established with any fidelity? Would you suggest that happens first?
Well, no, I mean, that is a decision. I mean, I shouldn't be as definitive about it, but that is a conversation within your district. But I think too, having said that, that even if you're not on your PBIS or anything like that, this might be a start. And if it's a mandate if it's a mandate for your state to go into the PBIS, then this might be something that could go hand in hand with it. Because a lot of the districts that we work with in California, most of them are in varying degrees of fidelity to the PBIS, but they're finding that it is really aligned with it, and it's actually helping them improve the PBIS and getting buy-in for it, if that makes sense. Because I think part of it is there's consciousness in terms of looking at everybody's safety, looking at the needs of the teachers, as well as looking at the needs of the students. I don't know if that makes sense, but I don't think that it's mandatory for it to go hand in hand. If this is something that you want to do first and it makes sense to you and where you can get more buy-in, then this might be your way into getting more fidelity for your PBIS. I'm not sure, because each subculture of the school is so different that you have to make that assessment and that call. And so what we're asking, for example, that Sherry Alternative High School, is for them to kind of look at what currently they're doing, what this is, and getting the collaborative input in terms of what do they want to invest in, and getting them to decide what makes sense for them the most.
Okay, thank you. Another question. Also, is there discussion when it comes to extreme rural districts with very limited resources?
That is definitely a challenge that's being felt across the board. And I think the additional challenge for that is depending on what state you're in. In California, we do have some of the resources that are web-based, but I know some of the suggestions that we have on our resource guide is from National Child Traumatic Stress Network. Some of them, they have the webinars available online, and also in some of the other resources, the U.S. Department of Education, you can activate and you can actually request the resource and the toolkits and all that stuff. But it's hard for me to answer it because each state is handling this differently and the access is different. And so for California, the rural areas, it is a challenge, but they still have access to it, but they also have to be creative in some of the access. And so one of the things is that they're partnering with some of their mental health agencies that might have different, like local practitioners who have expertise in particular areas and having them come in. They're also partnering with other districts so that they can have like cross-district sort of training and things like that. And then, for example, some of the strategic guides that we have, CBITs, those are available online as well for us. And then for teachers, we now have supports for teachers affected by trauma, which is online based. And so that's the STAT program.org. And so I think part of it is that being open to some of the suggestions and having conversations with potentially other districts, or joining learning collaboratives if you hear anything, and joining or going to websites like yours, Kelsey, or going to webinars that are offered for free, like what MHTTC is offering, because then you can tap in those resources where you might have the physical access to people to come and with expertise, but you can start looking at what are those online resources that's available.
Yeah, and our center's definitely available as a technical assistance center to help you think through some of these things. And again, I think your approach really is dependent upon, what indicator, what specific domain are you trying to move forward? Yeah. And so if it is training in those tier 2 evidence-based practices, I know that a lot of groups are trying to make training available virtually. Currently, as Vivian was saying, a lot of our trainings are available online, asynchronous, so you can go on at any time, start and stop, and take the training. And we are moving towards developing synchronous training, so that whether it's that secondary traumatic stress curriculum, our Trauma 101 curriculum, or any of our evidence-based practices, we're working on creating a way of doing that synchronous.
Yeah. And lastly, in terms of accessing further resources, I think being more open-minded in terms of what are you looking for, because DOJ are now making Department of Justice as well as SAMHSA. There's a lot of cross collaboration in terms of resources, pulling resources and making it available. And I think some of the initial trainings, the webinars that you did, helps us, helps you develop sort of the alignment in the language of those different federal government departments, and so that you can access those types of grants too. Like looking at cross collaboration grants, because more and more of them are doing that now, from the state level and the federal government level.
Great. So we did have a question about the STAT modules. So I went ahead and put that link in the chat for folks.
Okay. And that's next month's webinar.
Yes, it is. Nice little preview. So, all right. Well, we'll keep the Q&A open, but let's go ahead and go forward through the slides so we can just remind everyone about upcoming events on April 15th and on May 13th. And as a reminder for those who may not be able to get in because it's full, we're working pretty quickly to get things turned around, so these are all online for you. And as I've been hearing from more and more folks that are looking for online resources for staff during this time, I think this would be, as Vivian mentioned, an excellent resource. And I'll be working with Vivian and Pamela and a few other of our subject matter experts to see if from the MHTTC, our Northwest Center, we can maybe develop a resource guide that has some different options for online learning. I would just encourage each of you to reach out to us to let us know what your needs are, and we would be happy to share some of those examples with you. And just a reminder of how to connect with us. Reach out to Megan or myself, especially during this time when you may be looking for resources for your own self-care or looking for resources for supporting families and students during school closures. We're just here to help and support you, so please feel free to reach out to us. And I think that's it. So we will go. Let me just, although I do have a couple questions, let me see if I can get to those real quick.
Yeah.
Oh, just an excellent, thank you so much. Great presentation and fielding. Can you share the link to the webinar sign up, please? These are awesome resources. Maybe Megan can throw that in the chat so you can get to those. If not, you can email one of us and we'll send that to you. All right, well, just want to thank you so much to our guest speakers today for, as usual, an excellent presentation and great resources. And look forward to seeing you all at the next webinar in our series. And just, again, another invitation for you to reach out to us for additional technical assistance. Talk to you all soon.
Stay healthy, everyone.
Thank you. Take care, everyone.